Hi, I'm Sean Monahan from Monahan Dentistry and Implant Center. We are a full-service dental office right here in Mesa, Arizona. Now today we're actually talking about a super important topic, so I hope that you'll tune in for this entire video. I don't want you to miss any details. Today we're talking about sleep apnea. We're going to talk about who's at risk for sleep apnea, what are some of the complications, and how a dentist can actually help you with your sleep apnea. The first question we get is, what is sleep apnea? Well, sleep apnea happens when you stop breathing while you're asleep. Technically, doctors classify an apnea as any time that you stop breathing for 10 seconds or more, or if your oxygen levels dip by about 3 or 4%. So who's at risk for sleep apnea? Really, anybody could be at risk for sleep apnea. That would include infants and children, teenagers, adults, middle-aged people, elderly people. It can happen to anybody. It can happen to male or female. Now, there may be some things that put you at higher risk for sleep apnea, and that's important to know. Generally speaking, if you have a higher body mass index or if you're tending towards obesity, you will be at higher risk for sleep apnea. Now, there's other side factors that can put a person at higher risk for sleep apnea, and that includes the size and shape of their airway. That's affected by their jaw, their skeletal structure, their neck posture, believe it or not, and also the size of their tongue. So all these little factors play into whether a person's going to be at higher risk for sleep apnea. Now, the crazy thing is I can look in a person's mouth and usually within about 3 to 5 seconds, I can tell if they are at risk for sleep apnea. Which leads to the next question is, how does sleep apnea affect your oral health? Well, to start, people with sleep apnea, believe it or not, are more prone to tooth grinding. That's a little bit counterintuitive because you might think, well, if my mouth is open and I'm snoring, that must mean that I'm not grinding my teeth. However, people that snore, they go through little cycles of snoring and then gnashing their teeth, and it happens just for a few seconds, but it repeats over and over again throughout the night. The next thing that we see is people with sleep apnea, because they are mouth breathing a lot of the time, they have dry mouth. So if you wake up in the middle of the night and find yourself needing to take sips of water, or you keep that glass of water on the nightstand because your mouth is so dry, that is probably a bad sign. You may be mouth breathing and you may be prone to sleep apnea. Now, along with dry mouth and mouth breathing comes a higher risk for cavities. And that's because your saliva has a very important job, and that is to protect your teeth against bacteria and acid. But if your mouth is dry, the saliva is not doing its job. So you will have higher amounts of dental plaque, and in fact, the plaque will stick to your teeth a lot easier if your mouth is dry. So often we'll see plaque on the teeth, and then in turn, the gums start to get angry. So we'll see swollen gums, we'll see gingivitis, and if that goes unchecked, then you could be at higher risk for periodontitis. Now that's gum disease. Another thing that we'll find is a person with untreated sleep apnea over the years, their jaw can develop a different posture. They may develop a more closed jaw look or a more forward jaw look, and it could possibly lead to what are called TMJ disorders, where they have clicking, popping, or even pain in their jaw joint. So how can a dentist help to screen for sleep apnea? Well, we are very familiar with the signs and symptoms that go along with sleep apnea. So like I said before, I can look in a mouth and I can tell within a few seconds if you're at risk for sleep apnea. Now, officially, only a registered sleep physician can make the final diagnosis of sleep apnea. Now, that leads to the next question. How is sleep apnea diagnosed? Sleep apnea can only be diagnosed with what's called a sleep study. A sleep study has two formats. You can either go to the doctor's office where they have it dressed up like a hotel room, and you'll sleep in the clinic for a night or maybe 2 nights, and they will hook up a series of monitors to you so that they can see all your vitals, they can test your sleep cycles, and ultimately they're going to see how your oxygen levels are while you're sleeping. Another version that has become very popular is called the home sleep test. I personally am a big fan of home sleep tests because you get to sleep in the comfort of your own bed. Most of the home sleep test devices are very easy to use. Now, these are medical grade devices that are even more accurate than a smartwatch or a smart ring. So it's very important when you're making that diagnosis to have these higher accuracy devices. Now, the second version is called a home sleep test. Now, I'm personally a big fan of home sleep tests because you get to sleep in the comfort of your own bed. Now that's going to be more representative of your normal night's sleep. These devices for home sleep tests, they go beyond what a smartwatch or a smart ring can do. They have a higher level of accuracy that's needed to make the proper diagnosis. Once your doctor gets those results, they'll be able to see if you have sleep apnea or not. Now, I often joke with my patients that they'll get a mild, moderate, or severe diagnosis, but in the end I say, well, you're just mildly suffocating. Mild sleep apnea is still serious. It just means that you have a lower score than somebody with severe, but it doesn't mean that you're okay. Mild is still serious in the case of sleep apnea. So what are some of the treatment options? Now, the gold standard for somebody with severe sleep apnea is going to be what is called a CPAP machine. CPAP stands for continuous positive air pressure. Essentially, it's a machine that sits right on the nightstand, and you wear some kind of nasal mask or full mask, depending on what your doctor recommends, and that machine will gently blow air into your lungs while you sleep. In the old days, CPAP machines were very cumbersome, they were very noisy, and everybody complained about them. But in the last several years, CPAP machines have gotten smart. They're quieter, they can actually detect if the machine is being effective, if you're breathing properly. So definitely for a person with severe sleep apnea, they should at least attempt or try to wear the CPAP machine. Now, how about people with mild or moderate sleep apnea, or even a severe case that they can't tolerate a CPAP? Some people just can't tolerate the mask on their face. So in all these cases, I like to recommend what is called an oral appliance for sleep apnea. These are FDA-approved appliances that are custom molded to your teeth, and they actually hold your jaw in a special position so that you can breathe easier while you sleep. One of my favorite things about these appliances is they're very easy to use, they're portable. So I've seen people in the airport carrying a bag around with their CPAP inside. Well, you can't take that camping unless you have a generator or some kind of battery backup. So I really like these oral appliances because they are so portable, they're very easy to travel with, and they're great for that mild to moderate case, or like I said, even a severe case if they're not able to use a CPAP. These oral appliances are going to be their next best bet. Now, it's important to understand all of your treatment options. There are other options out there which may include surgery, but for most of my patients, I recommend they try these more minimally invasive treatment options before they go to surgery. So it's important that you sit down with me or your dentist or your physician so you can discuss the proper treatment options. Now, a word of caution about these sleep appliances, I've seen a lot of these things for sale on the internet. Many of them are pretty much one size fits all, or I've even seen the ones where they send a kit to your house where you can mold your teeth yourself. Just be aware that you would never want to treat yourself for a condition that wasn't properly diagnosed. For example, you wouldn't take insulin if you didn't have diabetes, and you for sure wouldn't do that without the care of a doctor. So I would not recommend that you go on the internet and buy one of these over-the-counter appliances. These are FDA-approved devices that need to be custom made for your mouth, and there's a custom position for your jaw that's going to be the most effective position. So I wouldn't waste your time or your money on these cheap appliances that you can find on the internet. One of the last tips I'll leave you with is some of the signs you want to look for yourself or for a loved one who may have sleep apnea. Number one is snoring. If you're snoring and it's a nightly thing, you're going to be at high risk for sleep apnea. The second is morning headaches. Oftentimes, if you've been starved for oxygen all night long, you're going to wake up with morning headaches. The next one is going to be excessive daytime sleepiness. If you find yourself sluggish or tired, or especially if you're falling asleep in traffic, these are very severe signs that you want to get checked out. So look for all those signs. And if you or a loved one is experiencing any of these, the next step to take is give me a call or give your doctor a call. We want to get you checked. I can be a good resource for you and get you to the proper doctors and get you the proper tests. And then if you need, we can make you the proper appliance. So set up a consultation today. The number here is 480-764-2111. Again, I'm Dr. Monahan from Monahan Dentistry, and I hope that I've answered some of these questions you might have had about sleep apnea. I look forward to meeting you soon.